Paribhasha means terminologies, and Paribhasha Sharira, it is a branch which deals about the explanation of each individual term along with its meaning. Let us study with few words which are mentioned in the first year BAMS syllabus. So the first word here we study is the Kurcha. Kurcha means fibrous structures, the structures which are fiber like in nature, which are formed out of the Snayu and Dhamani. They are brush-like structures. So there are 6 kurchas in our body. According to the shloka, that is Shat Kurcha. So where are they present? Hastayor Dve, 2 in the hands, Padayor Dve, 2 in the legs, Griva Medrayor Ekaika, 1 each in the Griva and the Medra. So 2 in the hands each, here you can correlate it with the palmar aponeurosis. So the palmar aponeurosis, it is a complex brush-like structure, as well as the plantar aponeurosis, that is the pada kurcha. The kurchas which are present in hand and leg, 2 each in hand and leg, and 1 in the griva, that is the neck, nuchal ligament, and in the medra, that is the suspensory ligament at the penile region. So these are the 6 kurchas present in the body. The next terminology we study is the Jala. The word itself here is self-explanatory. Jala means net or network-like structure. And there are 16 Jalas. They are 16 in number in our body. And 4 each of Mamsa, Sira, Snayu and Asti. That is, these 4 are the main divisions of the Jala. Each of these Jalas are further 4 in number. So that is 4 type of Mamsa Jala, 4 type of Sira Jala, 4 Snayu Jala and 4 Asti Jala. So the network-like structures in the body you can consider like the plexus. For example, Mamsa Jala means the muscle plexus. You can see in the flexor tendons, etc. Asti Jala, you can see the network of bones in the carpal and the tarsal bones. Snayu Jala are the plexus of the ligaments. And the Sira Jala means the plexus of the vessels, like the dorsal venous arch. All those things comes under the plexus of the respective organs. The next word for you to study is the Sanghata. The word itself tells that it is a joint. Sanghatas are the complex joints, that is more than 2 bones. When they are articulating, they form a Sanghata. And they are Chaturdasha Asthanam. They are 14 in number. And they are located at the respective places, 2 each. Gul for ankle joint, Janu knee joint, Vankshana hip joint, Manibandha wrist joint, Kurpara elbow joint, Skanda shoulder, Trik region, sacral region, and Shiras, that is skull. So this is all about the Sanghatas. The next word we study is the Simanta. Simantas are the structures that are connecting the asthis in the Asthi Sanghata. There are 14 Simantas according to Sushruta and 18 according to Vagbhata. So the difference of 5 here is because Sushruta has considered 5 Simantas present in the skull under the term Seevani. Seevanis are suture-like structures present in our body, and they are located 5 in head and 1 in the jiva, that is the frenulum of the tongue, and 1 in the shefas or the perineal raphe at the pubic region. These are the areas that should be prevented from any injury during the surgeries. The next term is Mamsa Rajju or just Rajju. They are strong thread-like structures and they are 4 in number, and they are present on both sides of the Prushta Vamsha, that is the either side of vertebral column. 2 in the inner side and 2 on the outer side. This can be correlated with the iliocostalis, longissimus and the spinalis muscle. Let us study about the word Lasika. Lasika simply means lymph. It is a part of Udaka Dhatu which is watery in nature. It is predominated by the Jala Mahabhuta. Now we will look into the word Snayu. Snayus are nothing but they are the rope-like structures like the Shana, that is the bow. It is the Shana Akara and it is belonging to the Upadhatu category. They are the binding materials in the body that binds the Mamsa, Asti and the Medas. Snayu are formed out of the Khara Paka of the Medas. Few Snayus are very thin, they are hairy thin, and few Snayus are network like appearance and they are very minute. and hence it is very difficult to locate these with the naked eyes. There are 4 types of Snayus. The first one is the Prathanavati. They are located in the shakhas and all the joints, Sarva Sandhi, all the joints and the shakhas. Vrutta Snayus, they are also called as Kandaras. Sushira Snayus are located in the ends of the Amashaya and Pakvashaya, like all the junctions of the gastroesophageal, etc. And Pruthula Snayus are located in the lateral part of the trunks, like chest, back, and the head region. The total number of Snayus in our body are 900. This is the classification of the number of Snayus in our body. The function of Snayu is just as the flanks of a boat are tightly bound by the ropes so that it can float and carry the weights on the water without any danger. The joints of the body are well articulated by the Snayus or the ligaments, and hence they are able to move and bear the weight of the body. Any injury to the Snayu is more harmful and causes more disability than if any injury is occurring to the Mamsa, Asti, Sira and Sandhi. Hence, a surgeon should take care to preserve the Snayus while operating or while performing any surgeries. Let us now study the last word, that is the Kandara. As discussed previously, these are the Vrutta Snayus or the round ligaments. They help in the contraction and relaxation of the muscles. There are totally 16 Kandaras in our body, distributed 4 in each, that is 4 in hands, 4 in legs, 4 in the griva or the neck region, and 4 in the prushta or the back region. In the hands, it can be considered as the flexor and the extensor tendons. In the legs, they can be considered as the tendons of the tibialis anterior and the tendocalcaneum. In the griva region, the tendons of the sternocleidomastoid muscle or the digastric muscles. In the prushta or the back region, the tendons of the erector spinae, longissimus and the iliocostalis tendons on either side of the vertebral columns can be considered as the Kandaras of the respective sides.